Hey, welcome to our lesson on anemia. This exemplar falls under the concept of cellular regulation. So cellular regulation is something you learned about in anatomy and physiology. It's the idea that the cell is the basic structure of the human body. Cells form organs, organs form organ systems form organisms. Every cell has a specialized purpose in the body. So when we're talking about anemia, we're talking specifically about the red blood cell. The word anemia means not enough of. So whenever you see an A in front of a term, and especially a medical term, it usually means lack of or none. So this would be a lack of red blood cells. So this can happen a lot of different ways. We can make enough red blood cells, but then we lose it. We can lose it traumatically, or it could be a chronic bleed. We could have enough, but maybe we're lacking the ingredients to really make a well-formed red blood cell. Like we just don't have the right ingredients, so these blood cells are malformed or they're deficient. Maybe we're not making it. Maybe there's just a lack of production, right? Or maybe we're making it and we're destroying it for some reason. So there's a lot of different ways that anemia can happen, and anemia really boils down to a problem with oxygenation. We need those red blood cells because they carry the hemoglobin, which is carrying the oxygen that we need to every organ in the body. So when we don't have enough red blood cells, we can't carry that oxygen, and then those organs become ischemic. They can even die. So it really becomes a problem with oxygenation. So we're just going to talk about a few different types of anemia. We can't cover every single type of anemia that there is, but we'll just go over the most common ones, the ones that your book talks about. Iron deficiency is the most common anemia that there is. That is because it is a combination of a nutritional anemia and also a chronic blood loss anemia will lead to an iron deficiency. So men and women don't have the same requirements for iron. And iron is an ingredient that is necessary in the production of red blood cells. So I think you can probably deduce why men probably don't need as much as women, right? We need like over twice as much iron as men because we're constantly producing to make up for loss. Pregnant women are then making blood for two people, so they require even more iron. So because that iron is necessary to make that red blood cell, a lack of it is going to lead to a lack of red blood cells, which is then going to lead to a lack of hemoglobin. And like I said, that's the underlying problem with anemia, is we need that hemoglobin to carry oxygen for us. Iron is also used in ATP production, which hopefully you remember that from A&P. But ATP is required for glucose metabolism. So when we don't have that, we're also not metabolizing glucose, and we're not producing DNA the way that we should. So really, the anemia aspect of iron deficiency is a late sign of anemia, or of iron deficiency, because anemia is not going to be the only problem that we see. So the risk factors could be just an inadequate consumption of iron in the diet. Maybe somebody is a vegetarian, for example, or vegan, and they're just not intaking that heme iron that's required for red blood cell production. Any kind of hemorrhage or chronic blood loss. So chronic blood loss could be a microbleed in the bowel. It could be heavy menstruation in females. That's going to lead to eventually a loss of iron stores, because you're constantly using up all that iron. You don't have anything stored anymore to make more red blood cells. African American women and Mexican women are at higher risk for iron deficiency, and females in general, and that's probably because of the menstruation piece. Postmenopausal women are also at risk though. Any older adult, and a lot of that has to do with diet, just not consuming enough. And then lead exposure. Lead inhibits the enzymes that are needed for production, but lead also competes with iron for absorption. So the same transporters that bind to the iron also bind to lead. So if somebody has a lot of lead exposure, they're absorbing the lead and they're not able to absorb the iron. So hopefully, we don't see too much of that anymore now that we know about the trouble with lead. So clinical manifestations, you have your classic symptoms of anemia, which will always be fatigue is probably the #1 symptom of anemia, and then hypoxia, the pallor, tachycardia, tachypnea. Glossitis is a little bit different. That is that beefy red tongue. You typically only see that with your nutritional anemias. And then this koilonychia, that is the spoon-shaped nails. So they kind of dip in the middle. We're going to diagnose this looking at a CBC, which is the complete blood count, and what we'll see on there is a decreased hemoglobin and hematocrit. And then we can also directly test iron and see what somebody's iron levels are and their ferritin, transferritin, and their iron binding capacity. So the treatment would be to increase the dietary intake of iron. So we'll find iron heme sources in meats. And basically all that means is you're eating another animal's blood. So if somebody's a vegetarian, they're not going to be getting iron that way. But ideally they would get a combination of heme iron and non-heme iron. So non-heme iron could come from leafy green vegetables, beets, beans, and then fortified cereals, and fortified foods. If they're not able to intake enough dietary-wise, they can take supplements. There are oral iron supplements. These are called ferrous sulfate. So they're best absorbed on an empty stomach, but they're not well tolerated on an empty stomach. They can cause a lot of GI upset. So pretty often we give this with food, usually with breakfast in the morning. If somebody can't do the oral supplements or that's still not enough, they may need an IV iron supplement. This is usually given in an infusion center where somebody can be closely monitored because there's a big risk of an interaction, almost like a transfusion reaction with this. And if you've ever seen it, it usually comes directly from the fridge or directly from being made because it doesn't have a long shelf life, and it's a dark, rusty looking color. Something else that you might want to tell somebody if they're taking these supplements is that it's probably going to change the color of their stool to like a dark greenish color, but it could be mistaken for a GI bleed because the color is so dark. So let them know that so they don't rush to the emergency room thinking they're having a GI bleed and it's really just their supplement. Whether they're taking supplements or ingesting this iron, it's better absorbed when taken with vitamin C. And their dairy and caffeine will inhibit the absorption. So it's really important to let this person know, if they're with their breakfast, for example, maybe not the coffee or the glass of milk, maybe they need a glass of orange juice instead to help increase the absorption. And then if this is caused by microbleed, then we definitely want to find the source and stop it if we can. Long-term iron deficiencies can lead to heart trouble, right, heart problems because of that constant ischemia, and also kidney failure. Your kidneys are very sensitive organs. They don't like not having enough oxygen, so it could lead to kidney failure. They're going to have trouble regulating their body temperature, impaired immune function, and then long-term, especially with children, this can lead to a lot of cognitive impairments, learning disabilities, just the brain's not getting enough oxygen over a long period of time. So vitamin B12, this is another type of nutritional anemia. It can come from a couple different things. Could be a lack of dietary intake or a lack of intrinsic factor, which is in the digestive system. It's necessary for absorption of that vitamin B12. So if you don't have intrinsic factor, you're not going to be able to absorb that vitamin B12. Vitamin B12 is not just necessary for red blood cell production, it's also necessary for all DNA production and synthesis, especially in the neurological system. So we see a lot of neurological problems with this, not just anemia. Some risk factors would be age. So as we age, we don't consume as many nutritious calories, so it could be just a lack of intake. Any type of GI surgery, so gastric bypass, Roux-en-Y, anything that's going to change the anatomy of your stomach or your small intestine is going to inhibit the absorption of vitamin B12. So any type of resection. Autoimmune disorders also cause a problem with absorption. So Crohn's disease and ulcerative colitis are two that we talk about this semester in Module 2. They changed the ability to absorb because it causes a lot of scarring and tissue damage, so you just can't absorb that B12 anymore. And then long-term use of medications that decrease gastric acid, like omeprazole, esomeprazole, pantoprazole, for example, that can inhibit absorption of B12. So like I said, this B12 is not only necessary for red blood cell production, it's also necessary for your nerve cells. So if you don't have enough, you start to see a lot of neurological problems, like spinal cord degeneration, neuropathies, change in mental status, even depression, visual changes. And then this proprioception is a lack of spatial awareness. So it's not being aware of where your body is in space. What this can look like is somebody being very clumsy, bumping into things, falling more often. So that can be a warning sign. And then you have your classic anemia symptoms like tachycardia, shortness of breath, dizziness, fatigue, and pallor. So we'll diagnose this doing a history of physical. So we know that if they have this autoimmune disorders or if they've had some type of gastric surgery, then they're probably already at risk. But we can also look at the CBC, which will show a low H&H. This serum MMA stands for methylmalonic acid. It's a byproduct of protein digestion. Vitamin B12 breaks down that protein and uses it for metabolism. So when you don't have enough B12, this MMA just kind of circulates in your bloodstream and the levels will be very, very high because it's not being broken down. And then we can just check vitamin B12 too. So treatment would be dietary intake of vitamin B12. So, make sure you're looking at foods that are high in B12. So some animal proteins are high in B12, like eggs, fish is high in B12. But then also some cereals are fortified in B12, and dairy has a lot of B12 in it too. Somebody can take oral supplements of B12, but if they're lacking that intrinsic factor because, of scarring or because of removal of small intestine or stomach tissue, it doesn't matter if we give them oral supplements. They're not able to absorb it, so they're probably going to need B12 injections. The shelf name or generic name of B12 is cyanocobalamin. When we give it as an injection, it's bright red in color. So it's given IM, and something to remember with this is that it can stain the skin. So if you want to be nice, you would give this the Z-Track method so that they're not getting little red dots everywhere. And then complications long-term would be, besides the anemia, they're going to have a lot of neurological complications, so peripheral neuropathy, impaired function. Like I said, that proprioception, that can lead to falls and injuries. So this is something that they're definitely going to need supplements lifelong if they have that lack of intrinsic factor for whatever reason.